Hi, I'm Dr. Wen Yin. Today I'm going to talk about type 2 diabetes and interventions to reduce its macrovascular complications. We all know that diabetes is a very common condition nowadays. It is what we call metabolic disorder. It is either due to defect in insulin secretion or activity that can lead to high blood glucose level in your body. There are type 1 and type 2 diabetes. Today, I'll be focusing on type 2 diabetes. Type 2 diabetes is more associated with insulin resistance than insulin deficiency. If your diabetes is poorly controlled, it can be associated with long-term complications, which will affect various parts of your body. Long-term complications of diabetes can either be microvascular or macrovascular. Microvascular means it affects your eyes, which we call retinopathy, nerves, neuropathy, or kidney nephropathy. Macrovascular complications affect heart, what we call cardiovascular disease, which I'll be talking a lot about today, or brain, which we know as stroke, and when it affects vessels, it is called peripheral arterial disease that mainly affect in your legs and presented with leg pain and ulcer. So, cardiovascular disease, which is the major cause of death in people with diabetes. Unfortunately, type 2 diabetes has 2 to 5-fold increased risk of cardiovascular disease. And studies have shown that the risk of heart attack, which is known as myocardial infarction, is similar to those without diabetes with previous history of heart attack. There are also other risk factors which can contribute to cardiovascular disease. These are high blood pressure, high blood cholesterol level, and obesity. Type 2 diabetes has strong association with these risk factors. Thus, modification of risk factor is very important in reducing cardiovascular risk. So, what can we do about reducing those risks? There are interventions such as lifestyle modifications and medications to control each and every risk factors, such as your blood glucose level, your cholesterol level, and your blood pressure. Let's start with lifestyle. We all know that exercise and healthy diet are key to improve your blood glucose level and also your body weight. It is recommended that 150 minutes of moderate intensity exercise per week or 90 minutes of high intensity exercise per week is to achieve good blood glucose control and to maintain healthy body weight. Saturated fat is also bad for your cholesterol level and thus should restrict the intake of it. Very importantly, last but not least, smoking cessation is strongly recommended to reduce the risk of cardiovascular disease. Before moving on to medications, let's talk about blood pressure and cholesterol target. Blood pressure should be checked routinely and should aim at less than 130 by 80 mm mercury. If that target is not achieved with treatment trial of lifestyle and behavioral therapy, then drug therapy should be considered. And for lipid, it should be tested annually, and its target LDL should be less than 100, triglycerides should be less than 150. Both of them are known as bad cholesterol. And the good cholesterol HDL level should be more than 50. In regards to pharmacological intervention, I would like to involve 3 main factors to control, such as blood glucose control, blood pressure control, and reduction in blood cholesterol level. So first of all, intensive glucose control is important to prevent macrovascular disease. One large study by EDIC and DCCD showed that by intensively controlling blood glucose level, there is 42% reduction in any cardiac event and 57% reduction in non-fatal heart attack or death from cardiovascular disease. Regarding blood pressure controls, the largest study for hypertension and type 2 diabetes, UKPDS, showed that treatment of high blood pressure can reduce the risk of macrovascular complications. The drug of choice are ACE inhibitor or ARBs, which are not only good for blood pressure lowering effects, but also for slowing the progression of diabetic kidney disease. Reduction of cholesterol level, as mentioned before, is also important in risk reduction for cardiovascular disease. Statin therapy is recommended for diabetic patients over 40 years of age as it can lower LDL, the bad cholesterol, by 30 to 50%. So far, I've talked about lifestyle and medications to reduce the risk of cardiovascular disease. There is one large study called STENO2 study, which showed that intensive multifactorial interventions in diabetes can reduce the risk of macrovascular complication and also death from any cause. Okay, so take-home messages are: good glycemic control is associated with reduction of microvascular and macrovascular complications of diabetes. We also need to treat other risk factors, such as high blood pressure and high cholesterol level. People think that diabetes has only to do with blood glucose level to reduce the risk of complications. However, it is not just about blood glucose level, but it is also important to control other risk factors. As the evidence says, multifactorial intervention is the key in reduction of complications. Here are the references. Thank you all for your time.